Hi, this is Dr. C. I'm going to go over some motions for you. So I'm starting in anatomical position. My feet are approximately shoulder width apart. My hands are with my palms forward. And I'm going to demonstrate flexion and extension to start with. Flexion means decreasing the angle between bones. So I can flex my neck, I can flex my shoulder, I can flex my elbows, I can flex my wrists, I can flex my fingers. I can also flex my trunk, and I can flex my hip. And notice that from the hip up, all of my flexors are in the front of my body. Now technically my body is in extension in anatomic position. I can go back beyond the plane of extension and hyperextend. My neck is now hyperextended, my wrists are hyperextended. Hyperextension means going beyond the plane of extension. So if flexion is decreasing the angle between bones, now my elbow is flexed. If I put my elbow back and my forearm back in anatomic position, my elbow is now extended. Now I can laterally flex going side to side with my trunk. I can also laterally flex my neck. I can rotate my neck. Atlas and axis take up 50% of the rotation, and then the rest of the rotation is done by the cervical spine. I can rotate my trunk, and there's also 5 to 10 degrees of rotation that occurs at the tibiofemoral joint, the knee joint, during walking. I'm not going to demonstrate that. That's too small for you to see. I can also take my arms away from my body in a process called abduction. Abduction, to take away, to abduct. I'm taking away from midline. Now, adduction means I'm adding together towards the midline, even crossing it. So that motion is occurring at my shoulder. I can abduct and adduct my fingers. I can abduct and adduct at the hip joint as well. Now, I can, because these next joints are ball and socket joints, move my extremity in the motion of a circle. That's circumduction. I can go either way with my shoulder joint. I can do this at the hip as well, circumduction. If I move body parts forward, that's protraction. So here's neck protraction, and then if I go backwards, that's called retraction. So here's retraction at the neck. I can protract my shoulders. I can retract my shoulders. I can do that with the mandible. Here's protraction, and then retraction. Now, I can also do lateral excursion, moving the jaw side to side. That's important for chewing. If we go down to my hands, you'll see that I can touch my thumbs to my pinkies in what's known as opposition. Reposition is simply putting them back into anatomic position. I can elevate body parts and depress body parts. I can do that with the shoulders. I can do that with the mandible. Depression, and then elevation is simply closing it. I can also, with body parts, again, from the hip, my hip flexors are forward, my hip extensors are in the back, because extension occurs from the muscles in the back. Except for below the hips, because now to flex my knee, I use the muscles in the back of my thigh to do knee flexion. Now, when it comes to the foot and the ankle, if my foot turns so that the sole of my foot is inward, that's what we call inversion. Inversion ankle sprains are the most common ankle injury. If my foot turns so that the sole of the foot goes outward, that is called eversion. If I were to bend my ankle so that my toes are pointing up towards my face, that is dorsiflexion. So if I walk on my heels, I am dorsiflexed. If I point my toe down towards the ground, that is plantar flexion. So if I'm walking on my tippy toes, I am in plantar flexion. And that's the quick and easy summary, whatever you want to call it. That's motion. Enjoy, move, have fun. Dr. C, signing off. See you later.